Good evening. I am Dr. Sheeba George, Senior Consultant Cardiologist and Interventionalist from Trivandrum. I'm currently working two places, one Jubilee Memorial Hospital, Trivandrum, and another place is at Workala Shivanarayana Mission Hospital. I am mostly an interventional cardiologist, but I do practice both non-interventional workup also. If a person doesn't have any specific symptoms of heart disease, like chest pain or chest discomfort on effort, or palpitation or undue fatigability on effort, he can be pretty sure that his heart is healthy. But he should adopt healthy measures to keep his heart healthy. That means he should follow a heart healthy diet, first of all. A heart healthy diet means a diet which is low in saturated fats, high in high fiber diet, and with a lot of high fiber vegetables, fruits, and nuts, less of saturated fats like red meat, and then mostly you have to avoid milk and milk related products like butter, ghee, and all. And it should be a balanced diet with more of proteins, moderate amount of carbohydrates, less of fats. We generally say that two types of heart healthy diets are generally spoken of. One is a DASH diet, that is low in salt. The sodium content of the diet should be low with a little higher potassium content so that it can take care of the blood pressure. And then I said about a Mediterranean diet. A Mediterranean diet is also supposed to be a very heart healthy diet with lots of fish, fresh vegetables and fruits, and less of saturated fats and meat products, especially the red meat, and also the milk products like butter, ghee, cheese, and all these things. Second most important thing is regular exercise. A heart can be healthy only if you maintain a regular heart healthy exercise program. The exercise should be based on patient's age and general profile of the patient. Means if the patient is very young, he can do high level exercises if he doesn't have any other comorbid illnesses. But for a person in the middle age or who already has a heart disease, high level exercises are not recommended. He should do moderate level exercises for at least 30 minutes a day for at least 5 days a week. A moderate level exercise means either a regular walking program on level ground, or swimming if he is well trained to be a swimmer, or he can do cycling if possible, or a brisk walking. So these are the exercises which are generally heart healthy. We don't generally advise isometric exercises. Isotonic and aerobic exercises are more heart friendly. And in between, you can do little bit of toning exercises like muscle training, but not very severe gym exercises are advisable. And for a person in his elderly age group, simple walking is the best exercise. And for those who already have had heart attacks or heart failure, big exercises or strenuous exercises should be avoided. The third important thing is check your morbid conditions, whether you are a diabetic, a hypertensive, or what about your cholesterol levels. You have to monitor these things and don't simply assume that you don't have these problems. And if you are a diabetic, keep the blood sugar levels as low as normal as possible, near to the normal levels. And if you are a hypertensive, keep the blood pressure always in the appropriate range. So other comorbid conditions like cholesterol levels, if the person has a dyslipidemia, the cholesterol levels should be controlled by diet as well as by statins if required. And look for other comorbid conditions like hypothyroidism, which may be the cause for the dyslipidemia and all. So a routine health checkup is very important to ensure a proper heart healthy life. Fourth important thing is to avoid stress. In this present COVID scenario, a lot of people are under big stress. So stress is detrimental to the heart health. So try to live a stress-free life. So for that, you have to adopt relaxation techniques and relaxation activities like yoga and meditations, which may be helpful. Another important thing is engaging in social activities, which will take away your stress. But in the current scenario of COVID, you are not able to move about much socially. But within limits, we can always be active by interpersonal healthy relationships as well. So controlling the blood pressure, controlling the blood sugar, controlling the lipid values are very important than physical exercise. And top of everything is to stop smoking if a person is a smoker. Quit smoking. There is nothing like reducing the smoke intake, but quit smoking. Then if a person is alcoholic, he has to reduce the alcohol, and the quantity should be only in moderation. So that is also very vital and very important. So apart from this, the heart healthy diet and exercises and proper mental habit can go a long way in protecting our heart. Of course, a perfectly healthy person can also develop heart attack because we cannot know the status of the blood vessels always by simple routine tests alone. So a heart attack can develop in any person under a stressful situation when there's a sudden plaque rupture inside the blood vessels. And as of now, we cannot assess the plaques clinically. So everybody may have deposits of cholesterol in the form of plaques in their coronary arteries. A rupture of the plaque can lead to or initiate the process of coronary thrombosis and heart attack. So also without any heart blocks, patient can develop heart attacks. The condition known as Takotsubo cardiomyopathy is there, where there's an acute stress which precipitates a heart attack. The patient may not be having any blocks, but a stressful situation can lead to the development of cardiomyopathy, which is dependent on the adrenaline surge, that is stress hormone surge causing myocardial damage. With the risk factors for heart attack, like a smoker, a diabetic patient, a hypertensive patient, somebody with a strong family history of heart disease, somebody under big stress, dyslipidemic patients, all these people have high risk factors for heart attack. Also obesity, sedentary lifestyle. So anybody having these risk factors and anybody with a strong family history of coronary artery disease should always listen to even the minormost symptoms. That is, any patient who develops a frank heart attack often have something called warning symptoms. On the previous 2 to 3 time, patient often experiences chest discomfort or central heaviness while doing some unusual exercises, or even there's a worsening of the symptoms during the routine activities. So patients should not dismiss these symptoms as just gas problems. Everybody has a habit of dismissing these symptoms as gastric upset or gas problems. So something like central chest heaviness, especially on effort, on climbing stairs or on walking uphill, if the person feels any of this discomfort in the chest, the substernal or central area, which may radiate to the shoulders or to the arms, or may radiate to the jaw or to the back. And with the cessation of the activity, the symptom may come to a stop. This is a classical symptom of an angina. And sometimes patients ignore this, or sometimes what they do is they will stop by the activity which results in this symptom. So there is a attitude of dismissing the symptom or just ignoring the symptom. And prior to the attack, often these symptoms happen at rest. Small episodes or shorter episodes of central chest discomfort, which causes distress to the patient, sometimes from making him get up from the sleep. This can happen, and still again they dismiss this as gas problems. So when any of these warning symptoms occur in a patient who has established risk factors for heart disease or a strong family history of heart disease, he should definitely seek a medical advice. An ECG in the normal state may not show anything, but still the person has to see a physician or a cardiologist, take an ECG, and if the ECG is normal, he can do a stress test, a treadmill test or some other stress test, which will definitely bring out the manifestation of the disease in at least in most of the patients. Definitely yes. The 7-member coronavirus family was known to be essentially a respiratory tract pathogen. But the recent SARS-CoV-2, that's a COVID-19 virus, has been shown to have an extreme predilection to affect the heart and the cardiovascular system. Almost about 30% of the patients with COVID infection are found to have cardiac involvement. The cardiac involvement can vary from myocarditis to even cardiogenic shock. The virus infiltrates into the cardiac myocytes and causes irreparable damage to the myocardial cells, known as necrosis of the myocardial cells or apoptosis of the myocardial cells, which lead to disruption in the cardiac function. The myocardites are responsible for the pumping action of the heart. So when they are damaged, the pumping action of the heart suffers. So an infiltration of the virus causes a severe inflammatory response, causing acute myocarditis. And if the myocarditis is extensive, it can cause myocardial dysfunction and cardiac failure, an acute heart failure or even a prolonged heart failure, and even cardiogenic shock. When the pumping power of the heart goes down by 40%, the person may develop what is known as cardiogenic shock. Also, the virus can produce a prothrombotic state. We know there's a pro-inflammatory state, which is referred to as a cytokine storm, or there's a prothrombotic state, whereby there is recruitment of the platelets, macrophages, neutrophils, and a lot of prothrombotic factors, which lead to intravascular clot formation or thrombosis. So, if there is thrombosis of the coronary arteries, which are the designated vessels of the heart muscle, it can result in acute thrombosis of the coronary vessels and acute myocardial infarction or heart attacks. So many of the patients with COVID infection present with heart attacks without the symptom of COVID as such. So it may be either myocarditis or it may be acute myocardial infarction, or the myocardial damage can lead to fatal conduction disturbances or fatal arrhythmias. Arrhythmia means the heart beating erratically at a very fast rate. The normal heartbeat is around 60 to 90. But when the heartbeat goes beyond 200 or so, it causes what is known as fatal tachyarrhythmias, of which the most common is ventricular tachycardia. And if not treated, it is quite fatal. So also the disruption of the conduction system can cause fatal heart blocks and even sudden cardiac death. Then there is widespread intravascular coagulation, not only in the arteries, but also in the venous system of the heart, which can lead to superficial as well as deep vein thrombosis. And deep vein thrombosis can in turn predispose to pulmonary embolism and sudden cardiac death. This is not only seen in the cardiac vessels, but it's also seen in the cerebral vessels causing stroke. Many young patients with COVID infection have been found to have strokes. This is due to coagulation or thrombosis in the cerebral blood vessels. And also this can lead to sometimes like a stress cardiomyopathy picture, similar to what we see in other situations. There is an acute cardiomyopathy picture where there's an acute dilatation of the heart with a presentation similar to heart attack and severe heart failure. There can be multi-system inflammation syndrome, which is described mostly in children with COVID infection. So also the SARS infection can lead to acute cardiogenic shock and death. So variable presentations are there, ranging from myocarditis, heart failure, heart attacks, venous thrombosis, deep vein thrombosis, to pulmonary embolism, or even strokes. All these are quite detrimental, and many of the patients succumb to these problems. And people with existing heart disease, like previous myocardial infarctions, or those who are having congestive heart failure, are more prone for these cardiac complications. But even healthy people, young people, and children are also very prone for these cardiac complications. There's an entity called endothelialitis. Means the lining of the blood vessels is known as the endothelium. So the virus is shown to specifically affect the endothelium and cause an endothelial damage, which is known as endotheliitis. That can again predispose to thrombus formation and myocardial infarctions and other vascular injuries. There was an apprehension in the beginning of the COVID season whether the ACE inhibitors and the ARBs, which are widely used antihypertensive agents, these are also used as cardiac failure, anti-failure measures. They're also used for the remodeling of the heart. So whether these agents are detrimental, because the virus utilizes the ACE receptor 2 for entry into the cells. But all the detailed studies have not shown that these agents potentiate or predispose a person to the development of COVID or causes a further deterioration in the COVID status. No. So therefore, all the associations have very vehemently said that there is no need to stop these agents, that is ACE inhibitors or ARBs, which are the mainstay of hypertension management in diabetic patients and patients with heart disease. So these agents can be continued and should be continued, except when the patient develops hypotension as a sequelae of the disease. When the patient develops myocarditis or heart failure, the blood pressure naturally will go down. And if there's a hypotension due to the disease per se, we may have to withhold the antihypertensive agents. Otherwise, all other agents, including antiplatelet agents, antihypertensives, anti-diabetic agents, and anti-failure measures, if they are already on, all these agents should be continued, especially statins also. Some of the newer reports say that patients who are on statins for dyslipidemia have a relatively higher protection against the COVID infection. So they should definitely continue these medications without stopping them, except the antihypertensives if the blood pressure is low. Otherwise, they should be continued. In the COVID season, I would strongly advise that we are all exposed to the pandemic so much. The risk of contracting the infection is very high. But keep our hearts healthy by doing a proper exercise program suiting the age and the morbidities of the patient, and take a proper heart healthy diet. Keep away from the disease as far as possible and as much as possible by appropriate social distancing, more than 2 meters from a person. And you should always avoid the situations of getting the infection by avoiding unnecessary socializing, unnecessary grouping together, and also use appropriate N95 mask. Don't think that's a waste of money buying a proper mask. It is for your own life protection. So we use a proper N95 mask if you are moving around. Even within the homes, if you have some visitors or if you have maids and all, it's good to use an appropriate mask at home also. And use face shields if possible when you have to go out in case of some important assignments. And then keep your proper medications according to the direction by the doctors. And in case of any doubt, don't hesitate to take advice from the doctors. Many people are now afraid to consult doctors because they think if they turn out to be positive, then a lot of issues follow, like they will be quarantined, they'll be forced to seek treatment and all. Patients who have had heart disease, who are on treatment for heart disease, and who have comorbid conditions like diabetes, kidney disease, liver disease, and patients who have had chemotherapy for malignancy, who are survivors of malignancy. All these people are prone to develop severe infections. So they have to keep themselves safe by social distancing and other activities, washing the hands frequently with soap and water or proper sanitizers. And when you are buying things from outside, avoid contact with the things for some time. And all these things we know, which have been highlighted in the media all the time. So please follow all these things and keep yourself healthy. And when you have the slightest doubt to the infection, please don't hesitate to seek medical advice. And if there's any worsening of the symptom, like an unusual breathing difficulty, unusual suffocation, or the feeling of not feeling good, that may be the only symptom sometimes, then don't hesitate to take treatment, have a proper consultation, or go to the designated COVID centers, have the treatment and follow their advices. If you have to be quarantined, be on proper quarantine. If you have to be in the hospital, be in the hospital, and take away all the stress of the disease, but stick on to your proper medication, a healthy diet, very important, healthy diet, and don't eat too much and put on weight, and eat the wrong food. All these things should be avoided, and face the disease boldly and be safe. And I wish all the viewers a very happy, healthy year ahead, and a happy World Heart Day too.